Greetings, my name is Hussein, and today we will look at the approach to the identification and treatment of sepsis in the emergency department. Sepsis is defined as suspected or confirmed infection with evidence of systemic inflammation which leads to tissue hypoperfusion. It is a significant cause of morbidity and mortality worldwide. Septic shock exists when cardiovascular failure occurs, which is evidenced by persistent hypotension or the need for vasopressors despite adequate volume resuscitation. The following criteria can be used to quickly identify sepsis in the emergency department. For sepsis, a suspected or confirmed infection with at least 2 of the quick sequential organ failure assessment QSOFA criteria, which can easily be remembered by the mnemonic HAT, which is hypotension, altered mental status, and tachypnea, which includes the components of respiratory rate of greater than 22 breaths per minute, altered mental status, and a systolic blood pressure of less than 100 millimeters of mercury. For septic shock, which is sepsis with profound metabolic, cellular, and circulatory abnormalities, the criteria includes a persistent hypotension which needs vasopressors despite adequate volume resuscitation to maintain a MAP of greater than 65 millimeters of mercury, or a serum lactate level greater than 4 millimoles per liter, which is greater than 18 milligrams per deciliter in the absence of hypovolemia. The mainstay of management of sepsis in the emergency department starts with early recognition, and then comes resuscitation, which is management of the airway, management of breathing, which is giving supplemental oxygen as needed to maintain an SpO2 of greater than 94%. Circulation, which involves establishing 2 large IV cannulas and giving 2 liters of crystalloids over 30 minutes. And then D, disability, which is assessing the level of consciousness and managing accordingly. Next comes early antibiotics, control of the source of infection, and other supportive therapies like hydrocortisone or vasopressors as needed. The ultimate disposition of the septic patient is the ICU or the HDU for further monitoring, source control, and hemodynamic stabilization. Remember, know the signs, know sepsis, identify and treat sepsis, and save lives. Thank you.